Good afternoon, everyone, and welcome to our Ask the Docs webinar on COVID-19. This webinar is brought to you by the New Jersey Pediatric Residency Advocacy Collaborative in partnership with the New Jersey chapter American Academy of Pediatrics, with funding provided by both the American Academy of Pediatrics and the Nicholson Foundation. My name is Brittany Johnson. I'm a Senior Program Manager here at NJPRAC, and I'll be moderating our webinar today. Before we get started, I want to thank all of you who submitted questions to us over the past week or so. We've received over 100 really thoughtful questions from our Family Success Center partners, and so we've done our best to address all of those questions in today's presentation. We scheduled this webinar for 1 hour, although in our effort to address as many of these questions as possible, we may go over that allotted hour by a bit. We are recording this webinar, so if you're unable to attend for the full duration of the session, we do plan to share the recording via email later today, and it will also be made available on the NJAAP website. To minimize any disruptions, all lines will be muted throughout the presentation, but we do encourage you to submit questions. At the conclusion of the presentation, we'll host a Q&A period as time permits, so please feel free to submit those questions through the Q&A box located on the webinar control panel, either at the top or the bottom of your screen. I do also want to share this brief disclaimer before we get started. We know that new and updated information on COVID-19 is being shared on a near constant basis, so it is possible that some of the information we share on this call may become outdated in a matter of days or weeks. And given that, we would encourage everyone to take a look at the Centers for Disease Control and Prevention website, as well as the World Health Organization website for the most current information on the virus. And with that, I would like to introduce our three speakers for today's webinar. Dr. Traba is a pediatric hospitalist and the Pediatric Residency Program Director at the Rutgers, New Jersey Medical School in Newark, New Jersey. In addition to her role in resident education, she's also the Interim Associate Dean for Education at NJMS, is a co-leader of NJPRAC, and a district counselor with the NJAAP. Dr. Verma is a pediatric infectious disease specialist, Section Chief of Infectious Disease, and the Pediatric Residency Program Director at Monmouth Medical Center in Long Branch, New Jersey. She's a member of NJPRAC and serves as a district counselor with the NJAAP as well. Dr. Pai practices pediatrics at Eric B. Chandler Health Center, a federally qualified health center in New Brunswick, New Jersey. She's the founder and director of the Resident Education and Advocacy and Community Health Program at Rutgers Robert Wood Johnson Medical School, and along with Dr. Traba is a co-leader of NJPRAC. And with that, it's my pleasure to turn the webinar over to Dr. Traba.
Hi, everyone. Good afternoon. I wanted to start with just a few of the common questions about COVID-19 itself. You've probably heard a lot of different terms associated with it, including calling it a, quote, novel virus, which just means it's a new type of coronavirus. We've had many other types of coronaviruses in the community previously, but specifically COVID-19 had not been previously identified. So why is it called COVID-19? Some have asked that. So the CO stands for corona, as you may imagine, and the VI is for virus, and then D for disease, and that's how they designated the name for the COVID-19. Coronaviruses in and of themselves are a large family of viruses and can cause illness in people, as well as some that only infect animals. In rare cases, animal coronaviruses can infect animals and then eventually emerge to infect people and then spread between people. And that is what is suspected with COVID-19. It was first detected in Wuhan City in China and then linked there from the live animal market. And as you know, it has now spread internationally across the world. So this is a common question. Is it droplet or is it airborne? And what does that even mean, right? So for the most part, COVID-19 is spread via droplet and not airborne. So what does droplet mean? It's based on the size of the particles, and how do you get those particles? You cough, you sneeze, and that produces what we call respiratory droplets. It generally has to be within close contact, which is where the 6 feet of distancing comes in. And then the droplets, though, can then enter your mouth, nose, or eyes, which is one of the reasons we encourage everyone to avoid touching your faces. That's where that's coming from, so that you're not reinfecting yourself with droplets that may have landed on you. Airborne is when the microbes are very tiny, so less than 5 micrometers, and they remain in the air for longer periods of time and can be transmitted over much longer distances. So again, in general, in the community, COVID is spread by respiratory droplets, not airborne. When you may see physicians or other healthcare workers, nurses, and so forth, where undergoing airborne precautions is in the hospital setting. There are settings where it can become airborne, and that's specifically for those usually that are critically ill, that require intubation, which means a tube down their throat to help them breathe, resuscitations like CPR, or other devices to help them breathe. So again, COVID-19 is generally in the community, is spread through respiratory droplets. And again, that requires close contact within approximately 6 feet of each other. And that is why we recommend that social distancing at the 6 feet mark. In terms of airborne, that would generally be limited to hospitals and critical care areas. This is a common question. How long does the virus last on surfaces? And you're going to see various timing in the media, meaning in the social media and on websites. And the truth is, I think we're still figuring out the exact durations, but we know it can be a few hours to a few days. However, again, for the most part, when people are becoming infected, it's from person-to-person transmission. However, it is important to clean and disinfect those high-touch surface areas. Tables, doorknobs, remote controls, those kinds of things, and obviously in the bathroom, toilets and sinks, to avoid cross-contamination. When at all possible, and I know this isn't always possible, but if you can, if someone is sick within your home, ideally you would have them isolated into a separate room to avoid the contact with others within the household. So this may seem a little counterintuitive, but if a person is isolated in that room, you may actually want to consider reducing the cleaning frequency because you don't want that unnecessary contact with the person. So if you are able to isolate a person that is sick within your household separately, you don't need to be cleaning after them left and right as long as they are on their own. However, if the bathroom does need to be shared with others, which is obviously common, then the bathroom does need to be disinfected after each use when it's by the person that is ill. And so we do recommend cleaning it after each use to avoid the spread from person to person within the household. So this came up as a specific question, even, do I need to change or wash my sheets daily? So if no one is sick at home, you really don't need to change that process. And even if someone is sick, if they're able to be hopefully isolated in a separate room, we still don't recommend washing the sheets daily. We just recommend that those that are well not being in contact with that person as much as possible. They do recommend, and this is from the CDC, for clothing, towels, linens, to actually not shake the dirty laundry. I know that may sound odd, but because then you could potentially dislodge the particles. So they just recommend putting it in the washer, use the warmest water setting you can, and always dry the items completely before use. Obviously, if someone is ill, then ideally you'd be washing their laundry, can be washed with the laundry of others because you're putting it through the process. Just make sure you're washing your hands well before and after touching any potential soiled items. You can see the picture on the center of the screen gives you what they're calling EPA registered disinfectants. So some common examples would be Clorox, Lysol, Purell, but there are a multitude of ones that you can search online as well in terms of which disinfecting things you can use for sanitizing. So how do you differentiate between COVID, allergies, and the flu? Honestly, between COVID and influenza, the symptoms actually overlap significantly. So I think between those two is pretty difficult. And right now, currently, we're seeing more cases of as the cases of COVID are rising, less cases of flu at the same time. But the symptoms do overlap. It's usually about anywhere from 2 to 14 days after you were exposed to the virus that you start to develop symptoms. The most common symptoms are fever, cough, and shortness of breath. However, many are reporting headaches, stomach upset such as vomiting or diarrhea, muscle aches, or even sore throat associated with it as well. So it could be a wide range of symptoms and can definitely overlap with symptoms of the flu as well. In terms of severity of symptoms, it varies widely. Most patients will have mild, and some may even be asymptomatic completely. And we'll go through some of the risk factors to have more severe disease. So when should you go in and be seen? So the major warning signs would be difficulty breathing, persistent pain or pressure in your chest, any type of confusion, or if you're unable to arouse your family member or other household, and then any bluish discoloration of the lips or face. If you only have the cough and the fever and are otherwise breathing okay, it's generally recommended to avoid going directly to the ER as long as you're able to drink and keep fluids down and so forth, because of potential spread to others there as well. Allergies. So a lot of these can overlap with common viruses. So allergies more commonly will have the sneezing, but can also have runny nose. The watery, itchy eyes are often a big sign, and you can also have ear congestion or postnasal drip. Less commonly, you may have headache, or it may trigger wheezing, especially in those that have underlying asthma. I'd say the biggest thing, though, is fever would not be a sign of seasonal allergies. So that, and you can try over-the-counter allergy medicine that obviously usually would not respond if it was COVID or another virus within that. But again, fever would be one of the bigger red flags between the two. Am I only at risk of getting severely ill or dying if I have a compromised immune system? So the truth is, no, everyone could potentially be at risk. However, the numbers show by far these are the certain individuals are at higher risk for severe illness. And so those individuals that are at higher risk are the elderly, so individuals that are 65 years or older, those that are living in a nursing home, and that's also related not just to age, but to people living in close quarters and thus can be spread. Anyone with chronic lung disease, and that includes moderate or severe asthma, heart problems, and of course are immunocompromised that may be cancer treatment, had recent transplant, HIV, or those that have other medical problems that require prolonged steroids. Additional risk factors that are less well-defined, obesity, diabetes, renal failure, and liver disease. Right now, unfortunately, we don't have a lot of data for pregnant women, and so that's something we continue to look at closely. There have been a couple of cases, that we've seen recently, and there's just not enough data to know that. At this time, the data that's from internationally has not shown a specific increased risk in pregnant women, but obviously that's something that's being monitored in real time. Is COVID-19 making young children sick, and how severe is the virus for them? So all three of us that are leading the session today are pediatricians, and thankfully, for the most part, actually pediatric inpatient admissions have gone down across the state and nation. We are seeing far less children being admitted versus the adults, and we know that adults do make up the vast majority of cases at this time. However, children can become sick from COVID. They generally will have similar symptoms to the adults, but they are much, much more likely to have mild symptoms versus adults. Now, in terms of higher risk for severe illness, we're still looking at data within that. Obviously, we're paying special attention to those children that have underlying medical conditions such as asthma or other special healthcare needs. What research is being done worldwide? So I put this snapshot from the WHO, the World Health Organization. There is ongoing research, and it is being pushed out as quickly as possible to give us healthcare providers as much knowledge as possible to treat individuals with COVID. So that's the short answer of it, but there are resources throughout that are coming out on an ongoing basis. But like with anything, it's our job as the healthcare provider to review that research and to see, how we apply it to every day. So while there is a ton of research being done, there is still so much more that we do not know yet, and that we are gathering that evidence so that we can create better plans moving forward. Is it okay for you to donate blood? Yes, the pure act of donating blood is definitely safe. I think it's a little bit harder right now because of the circumstances, but I know the Red Cross and others are looking into ways to offer that. I think the most important thing I would say is that if you call or go through the website and potentially set up an appointment, so it's a one-on-one, and so that you're not in a larger setting where others are there for potential exposure. So I know we are having blood shortages because of the decrease in the blood drives, as for obviously for the social distancing component. So again, I think going through the American Red Cross and American Blood Centers, and there is potential to make specific appointments to minimize exposure to others to donate blood. So of course, how do we prevent it? So of course, while it's easier said than done sometimes, the best way to stay healthy is avoid being exposed. So how do you do that? So again, as I explained a little bit earlier, it is spread generally through person-to-person contact, and really that close contact within the 6 feet range. Again, it's respiratory droplets from coughing or sneezing that will land on the mouth or nose of people nearby. So what should you do? In general, really, at this point, I think everyone, if you possibly can stay home, stay home. But especially if you are sick, you should be staying home. But remember, even within your house, to protect you from other household members, make sure if you're coughing or sneezing to either use a tissue or something to cover, or use the inside of your elbow, as demonstrated here with the picture, to avoid spreading it to others. So what does social distancing mean? I think this has become the hot topic or term across the nation and even internationally. So it means staying at home is a big thing, only leaving if you absolutely have to for essential shopping or other needs. And even with that, I would encourage you to try to go on off hours as much as possible to just avoid contact with others. Traveling to and from work, obviously if you're an essential employee, that may be necessary, but otherwise at all possible staying home. And there should be really no public gatherings at all. I know the schools are closed statewide, but other events have been canceled as well. In addition to just staying at home, we really want to avoid contact with others that you would otherwise not share your home with anyway. So this is not the time, unfortunately. I know we have the time, but it is not the time to schedule play dates with classmates for your children, to have others over for dinner parties or birthday parties. We encourage you to celebrate virtually, which I know there's been a lot of great ideas out there, but to limit your interactions with others within that. If you are, I know some have asked, can you go out to the parks and so forth? If you want to go outside, that's fine. I think, again, though, it's keeping that social distancing component, and we really encourage you to avoid playgrounds and things like that where they can be contaminated and aren't necessarily being cleaned on a regular basis. But again, that should be within your own household, outside, not necessarily meeting up with others and so forth in the outdoors. If I am in close contact with someone and less than 6 feet away, can I get the virus? Yes, absolutely. So that's the key, is that distance, because again, like we said, it's spread through respiratory droplet, not through airborne. And so it can only go so far. So maintaining that distance is one huge part of it. In general, most people are most contagious when they're actually symptomatic. And so, however, it is possible with those with mild symptoms or minimal symptoms to spread as well. But again, the most contagious are those that are actually symptomatic. And when, again, it's usually spread from person to person, but potential spread if something is contaminated, like the doorknob or whatnot, and you touch that and then touch your own mouth or nose or eyes, could then potentially become infected. So that's, again, can't stress enough, avoid touching your face at all costs. It's a hard habit to break, I admit, but it's really important because, again, your skin is a protective barrier from the virus. But if you touch something and then touch your mouth, nose, or eyes, you can potentially infect yourself. Hand washing. Honestly, wash your hands as often as possible. If you're thinking about it, I would wash your hands. You want to obviously use soap and water, or you can use hand sanitizer. If you are using hand sanitizer, you need to make sure it's at least 60% alcohol, and it should say it on the bottle. When you're washing your hands, it's a minimum 20 seconds of lather and scrubbing time. So a nice fun thing to do with your kids is to just have them actually sing the happy birthday song twice, and that's roughly 20 seconds. You may see social media videos and such posted where they use different songs. Whatever you can do to make it fun with the kids is awesome, and fun for yourself as well. But again, the 20 seconds is the key. And again, singing happy birthday or any song you'd like for 20 seconds is a great way to make that go by quicker. Medications to stay away from. So there's been a lot in the news about what we call non-steroidal medications, or what is in the family, which is ibuprofen, Motrin, Advil, and so forth. The FDA has published a statement that there's no clear evidence to avoid ibuprofen or Advil and so forth. However, some are recommending still to at least use Tylenol, which is also the generic, is called acetaminophen, for fever or pain, and avoid the NSAIDs if possible. Again, there's not clear evidence for that. However, many are recommending to at least start with Tylenol first, and if possible, to avoid ibuprofen. So what should you do if you traveled recently? Honestly, at this point, COVID is pretty widespread through our communities in New Jersey and New York. So really, it's just self-monitoring for symptoms. And I cannot stress enough that we do not recommend travel. If at all possible, not recommend it. Especially airports, buses, trains, all of those modes of transportation are potentially exposing you to others that may be infected with the virus. So really, that's part of the social distancing, is avoiding travel if at all possible. This is a hot topic right now, I'll admit. Do you need to wear a mask or gloves? So in general, our recommendation is only to wear a mask if you are sick. I know there was recent press release and conference yesterday about this and the potential of recommending masks to the public as well. I will say, and I can't stress enough though, healthcare providers are in dire need of surgical mask and what's called the N95 or the respirator mask. So we really do not recommend those outside of the healthcare world bulking up or buying those, because it would potentially take away from healthcare providers and their ability to care for those that are ill. However, I also want to reinforce for those of you, if you do have masks at home and choose to use it, that the mask itself isn't enough, okay? It doesn't take away the need to wash your hands and or use hand sanitizer, and that's before and after you have a mask on as well. Okay, the mask itself is just protecting stuff from either you coughing and having those respiratory droplets go to someone else, or from it coming into your mouth or nose. But remember, that mask after you have it on is potentially contaminated. So if you start touching your mask, then you're contaminating your hand. And then when you take that mask off and touch your face again, you've contaminated yourself all over again. So again, it is not a foolproof thing, and in and of itself is not enough. You must can't stress enough, washing your hands and or using hand sanitizer frequently, and just avoiding touching your face at all costs. And children in general do not need to be wearing masks. Again, the only time that we generally recommend is if an individual is sick, but otherwise, again, hand sanitize or hand wash. For the masks that you commonly see, the one-use mask, we don't recommend reusing it over and over again, because those are meant to be thrown out. And then what you're potentially doing is having a contaminated mask that you can't clean, and then you're putting it on your face over and over again, and again, potentially causing more harm than good by having that, potentially infecting yourself with the virus. So supplements, some are looking into some association with vitamin D, and vitamin C we've always said can help support. So I think they're in general safe to use, and just general vitamin supplements. But unfortunately at this time we don't have evidence to widely recommend a specific supplement or vitamin at this time. So this was a question, a few questions came up about this. If you are not documented, how will you be cared for in the event that you present with symptoms? And I cannot stress this enough. All individuals have the right to receive urgent and emergent care at any emergency room, regardless of immigration status. Please, please, if you are ill and having, short of breath or having worsening symptoms, do not hesitate to get evaluated because of that. Again, all individuals have the right to receive urgent, emergent care at any emergency room, regardless of your immigration status. Telehealth services are available. It depends on the offices. I know for the locations that we work at, they are offering telehealth. Some are doing it with video options, and some are doing it simply via phone. I think most offices are trying to screen patients in advance before you come in person to limit both your exposure if you don't need to be there, but also to decide who needs to be seen and to work that out. So I would encourage you to call your pediatrician or your primary care provider and see how they're doing it. Each practice has set up their own systems, but I think for the most part, all have at a minimum phone call ability, if not additional telehealth with video options. So the shorter answer, so yes, you can have COVID and be asymptomatic or mild symptoms. Again, we know that you're most contagious when you have symptoms, but some will have no symptoms at all or very mild. And again, that's more common than not to not have more severe symptoms. What should you keep in your home in case you develop symptoms? Honestly, I think the most important things is really just having fluids and so forth at home, because it's really supportive care if you do develop symptoms, meaning Tylenol or acetaminophen, and staying hydrated. Obviously, having an emergency contact list is important, especially if you live alone, so that someone is aware that you are ill, so they're checking in with you every day. And then really just cleaning and disinfecting those frequently touched objects and surfaces like we talked about. But those are the main things to have at home at this point. Okay, I think I'm going to hand it over to Dr. Verma now for the testing component.
And Dr. Verma, we can't hear you. I'm not sure if you need to unmute your speaker, your microphone.
Can you hear me now?
Yes, we can. That's great.
So this is Dr. Verma. Good afternoon, everybody. Most of my presentation is around the test for the COVID-19. So the first question I have is, will my family need to pay to be tested for COVID-19? What if I don't have health insurance? For anyone who's staying home, has had no exposure, and had no symptoms, you do not need to get out and get tested. If you are sick and have symptoms of fever, difficulty breathing, cough, then you must go to the hospital. Currently, it is in the best interest of everyone's health that anyone and everyone who is sick must be treated. And there is no sick patient who will be turned away from the hospital regardless of the insurance status. So this is just to reiterate the same point as Dr. Traba was mentioning. Can undocumented families get tested? What happens if the results are positive? Anyone and everyone with the true symptoms and the history of exposure can be tested. And exposure means that you are in contact with someone who is sick, or you have traveled to the area where the disease is prevalent, which currently is pretty much all areas that you are in contact with in New Jersey as well as in New York. You don't have to have a travel history from outside country. If the test is positive and you are feeling sick, then you should go to the hospital and seek care. If you are positive and have no symptoms, then stay at home and take good care of yourself with the lots of fluids, Tylenol, and also maintain the physical distancing with other family members. Can undocumented families get tested? And what happens if the results are positive? So there is a lot of concern about the new rule that has been put in place regarding immigration and the public charge. From the same website, it is emphasized that the U.S. Citizen and Immigration Services encourages all those, including aliens with symptoms that resemble coronavirus disease 2019 or COVID-19, such as fever, cough, shortness of breath, to seek necessary medical treatment or preventive services. Such treatment or preventive services will not negatively affect any alien as part of a future public charge analysis. So again, please, if you're sick, don't hesitate to go to the hospital. Another thing which also was recently passed, the law, Family First Coronavirus Response Act, or FFCRA, passed on March 18, provides coverage for Corona-19 testing for uninsured through National Disaster Medical System reimbursement. So do not hesitate to get tested if you have true symptoms. Is there a specific criteria I need to meet to be eligible for COVID-19 testing? Yes. Travel to the areas with the widespread ongoing transmission, which the map is showing in certain areas, but keep in mind, right now the disease is very prevalent. So even if in our own neighborhoods, there are hotspots, Freehold is one of them, Bergen County, Lakewood area. So if you have had exposure there and have known patient in your close contact, that's a criteria for testing. Or if you are a healthcare worker. Symptoms such as fever, sore throat, and worsening cough is another criteria that would make you eligible for testing. What if I haven't had direct contact with someone who has the virus, but I have been out in public and now have symptoms? Can I get tested? Yes, if you have symptoms, call your doctor or healthcare center, because there is a specific procedure. They will bring you in for the appointment. Most of the offices who are seeing patients with the COVID-19 suspected case, they are keeping the patients in the car and bringing them with a specific procedure by putting the mask, etc. Get an appointment ahead of time. If you do not have any physician or healthcare provider, then go to the emergency room and get tested and treated. If you are severely sick, again, do not wait and go to the nearest hospital. How do I get tested and where can I get tested? The hospitals are testing based on the criteria, as we mentioned, based on the treatment, the symptoms, as well as the exposure history. Currently, what I know, most of the community health centers are not testing because the test facility is not easily available. Some of the labs are certainly doing it, such as the LabCorp and the hospital labs. Without known exposure and illness symptoms, stay home, stay safe, and take care of good hand hygiene. There are other testing sites right now in the state of New Jersey. I know PNC Art Center has one, there is Paramus Mall has one, and there is another Kilmore Inspection Center where there is an open testing site. Most of those are testing either true exposures or patients with the symptoms and healthcare workers only. If I need to get tested for COVID-19, is it painful, and how do they test for the virus? It's a simple test. Same way as the strep throat is done, there's a swab that is taken from your nose and put in a small container of liquid, and then it's put through a machine where they do look for the viral particles. Based on the techniques that are available right now, it could take anywhere from 1 hour to 3 days for the results. And just yesterday or 2 days ago, another the test was approved by FDA, which will actually give the results in 5 minutes. And that is made by Abbott. So I think as we speak, the information is really changing very fast. Testing positive for COVID-19. If someone in my household tests positive, should I get tested? If there is a COVID positive history and you are sick, go to the hospital. If you have mild symptoms that is similar to common cold, then self-isolate yourself and or quarantine your other household members. And in the further slides, you find out what does the self-isolation mean and what is the difference in the isolation versus quarantine, and that would be explained later on. And that's where I am going to hand over to, I think that's where I am handing over to Dr. Shilpa Pai.
Good afternoon, everyone. Thank you, Dr. Verma. So when we're trying to differentiate, there is a lot of confusion between what is self-quarantine versus what is isolation. So first of all, kind of going back to that last slide, so self-quarantine is really just what we hear commonly about sheltering in place. So that means really limiting your interaction with the public, trying to stay away from going to stores, and as much as possible, staying away from household members, which can be difficult, and sleeping in separate places from your family members. So who should do this? If someone doesn't have symptoms, but had close contact with someone who later became infected, or if you're living with someone who is in self-isolation. That being said, self-isolation is someone who is infected, or someone who's waiting for their test results. So, or someone who has really positive, obvious symptoms like the fever and cough. And for those people, when possible, confining that person to a separate room. And as Dr. Traba mentioned, it can be difficult depending on space, but trying to use a separate bathroom if possible, or sanitizing right after it's being used. And that also means minimal contact with household members, and that does include pets as well. For those who are in self-isolation, food should be brought to their door. So you can leave it at their door, and once the food has been dropped off, the person who is in isolation can open the door and then pick up the food. And a lot of questions came up about why 14 days. So 14 days is the incubation period for the virus. So that being said, there was a study that came out of Johns Hopkins University that the majority of people who develop symptoms of the COVID-19 infection will do so within 11.5 days of exposure. So really feeling like that 14 days will capture people who are actually infected with the virus during that time. So where have people in New Jersey tested positive? And so this chart is from yesterday. And as we know, things are changing very rapidly in our state right now. Patients are being treated in hospitals. So when we say treatment for the virus, it's really just to make sure that they're breathing well on their own and they're having, and that they're comfortable. So if they need oxygen, some people need IV fluids, some people need to be placed on a ventilator if they need more help with breathing. So that's when we talk about treatment. If they're in the hospital and once they feel better and have no symptoms or less symptoms, that's when they can go home. But when they go home, we still have to complete that 14-day quarantine. And a question came up about children. How many have children died from the virus? So right now, when babies are being tested, or young children have been tested and that they are positive, overall, if they do not have underlying illnesses, like we mentioned earlier, they've been doing well. And in terms of, as of right now, I have not heard of any reported deaths amongst children from COVID-19. And we're usually more worried in those children who have some type of immunocompromised status. So if I tested positive for COVID-19, will I have to get tested again? So a patient who has no symptoms, retesting is not going to be done because, again, right now we do have a lot of limitations in our resources, including testing kits. If you remain asymptomatic, meaning without any kind of symptoms for 14 days after being positive, it's not likely that you're going to have the infection again and become symptomatic again. So when do I go to the hospital if I've tested positive for COVID-19? And how do I know when my symptoms are getting worse? So like Dr. Verma and Dr. Traba mentioned earlier, if you have the virus, for the most part, we're telling you to stay home because you want to protect others in the community, including yourself. However, if you have a cough that's getting worse, if you have any difficulty breathing, any tightness or pain in your chest, change in colors in your lips or your face that turning blue, and if your symptoms are progressively getting worse, those are all signs and red flags that you should probably go to the hospital to get checked out. After recovering from the COVID-19, some questions came up. Can I spread this to others? So you may still have some virus shedding, so we don't want to be too relaxed about that. So it doesn't mean you can go right out into the community, because if you are still shedding that virus, but you may have developed immunity, but you want to make sure that you're not spreading to someone else that is not, that you could shed it to someone else as well. About returning to work, if you have no symptoms, and it also depends on your employer. So you should check with them first before returning to work. Can the virus be transferred to an unborn child or through breast milk? So right now, we don't have any clear information about that. After birth, babies can get infected. However, we're finding that they're not having the symptoms that we're typically seeing in older adults. Now we're going to move on to thinking about how can we support ourselves, our family, and our community during this pandemic. So one of the questions that came up, what is community spread? So community spread is when people are infected with the virus in a certain area, including some who are not sure how or where they became infected. So before, when we're seeing people coming in from certain countries, or there was a known exposure, that was when we were thinking we kind of knew where that infection was coming from. But community spread is meaning it's coming into the community and you don't really know where it's coming from. This chart, I apologize, it's a little unclear, but this was from last night on our New Jersey website, talking about all the hotspots in New Jersey and the numbers. This is something very important. Question came up, can I go outdoors? Yes, that's a resounding yes. One of the most important things I feel is for people to go outside. However, it is important that you stay safe when you're outside. So for children, that can be difficult in terms of talking about physical distancing. So we keep talking about these 6 feet, but I think for younger children especially, that is difficult to maintain. So it's also about using common sense and knowing what your child is able and unable to do in terms of the physical distancing. That being said, if you're going outside, you should really try to do parks or open fields, hiking trails. You want to go to places where there are not a lot of crowds. A lot of playgrounds are closed right now, and that is because playgrounds are usually more contaminated because the virus can last longer on hard surfaces and they can be more crowded. So while many playgrounds have been closed, or if they haven't been closed, it might be for the best to avoid those areas. Even when you're thinking about sports, a lot of people think, oh, can I go out and play sports? But think, if you're going to be touching a ball and throwing it back and forth to someone else who's from another household, that's another risk factor for disease spread, because that person, if they have the virus and they have it on their hand and they throw that ball, now the virus is on the ball and now it's spread to the other person. What is safe, however, is running outside, walking outside, biking outside, and that could be with a household member. And it is safe to drive. So I know questions have come up about going outside and taking a drive. Absolutely, you can go in your car and take a drive. But as always, the big theme of today is washing your hands as soon as you get home and making sure you wash for at least 20 seconds. How about grocery shopping? Is it safe? So really trying to go during off-peak hours when it's less crowded. You want to really limit your interaction with other people. And that means maintaining that physical distance of 6 feet when you are grocery shopping. A lot of the grocery stores are having people wait outside, and then while waiting outside, maintaining that 6 feet distance, which I think is a great idea, and limiting the number of people at a grocery store at once. And just being cautious, you could wipe down your handles on your shopping cart, really, like Dr. Traba mentioned earlier, really trying not to touch your face while shopping, washing your hands before and after going. Again, maintaining the distance of 6 feet while in the grocery store, outside the grocery store. And after you unpack the food at home, again, wash your hands again. You can't wash your hands enough. Can I order takeout or delivery? Is this safe? If so, what precautions should I take? So the main risk from ordering food is basically if the delivery person is infected, and if they sneeze or cough on you when they bring you the food, that's how the virus spreads. Because again, it's person-to-person contact through respiratory droplets. You're less likely to get the virus from touching contaminated packing. And there's minimal to no risk of contacting getting the virus by eating it in cooked food, because it's not a foodborne illness, it's a respiratory. Small risks of touching raw food that virus was on and then touching your face. So ordering is generally safer than going to the grocery store or the restaurant, only because, again, it's all about minimizing your contact with other people. So how to protect seniors or high-risk individuals while grocery shopping. So a lot of the grocery stores in the state have really trying to protect our seniors, and those are higher at risk. So they have specific reserved hours. A lot of places are offering online shopping or outside pickup service and delivery to your door. So really encouraging our seniors or high-risk individuals to take advantage of that. I put up some slides about where they are in different parts of New Jersey, but it's easily accessible online, especially at your local grocery store if they do have those special hours for seniors. If I'm not exhibiting any symptoms, but I've been out in public, can I be around other people like my grandparents? So I find this is a really difficult one to answer because a lot of times our seniors are more socially isolated. However, it is really important at this time that we stay away from nursing homes, retirement, or long-term care facilities. Older adults should minimize contact with children. So there was a research study that out of the Journal of Pediatrics that about 13% of children with confirmed cases of COVID did not show symptoms of COVID virus. That being said, you really want to minimize the risk of a child without symptoms passing on a disease to their grandparents. However, it's also important that we think about how can we help our more senior relatives and friends. So thinking about setting up virtual visits or FaceTime calls, offering to do their grocery shopping for them, or even setting some care packages for them as well. How long do you think social distancing will last? How long will it take for the virus to disappear? So right now we're finding that physical distancing is really the only thing that works. Once we drop these measures and we start allowing people to congregate in big groups again, while the virus is still out there, because remember, a lot of people can have the virus but not have symptoms. And if they start gathering in big groups again, it can start new outbreaks and again, threaten the public health, especially those who are older and chronically ill, and those who are most vulnerable to severe illness. So the way things are looking like right now, we need to do something to stop the virus to enter the threat. So really right now, we don't have an answer. People are looking if there's a vaccine. There's some clinical trials, some research that's going on right now, if that would be possible. Herd immunity, you may have heard that term before. And that's basically saying that when enough people have contracted the virus and have become immune to it, that's going to slow its spread. But again, we don't know how people will react once they do get infected with the virus. So there really is no good answer for how long it'll take for the virus to disappear. Should I go to work if there's an outbreak in my community? The biggest answer to that is stay home if you can. Really important, again, stay home as much as possible. It's important to talk to your employer if need be, and taking leave if you need to take care of a sick household member as well. Will warm weather stop the outbreak of COVID-19? Again, another great question. Don't have that answer to either. A few days ago, Dr. Fauci, who is the director of the National Institute of Allergy and Infectious Diseases, said that there may be a seasonal cycle to the pandemic. It could ease in parts of the North America and Europe during the summer months, but it could always just come roaring back in the fall. So we really don't have an answer to that, and no definitive stop date about what's going to help stop the outbreak of the virus. Will school be canceled for the rest of the year? I have no idea, unfortunately. I know some schools in New Jersey have, the private schools in New Jersey, a handful have already canceled their sessions for the rest of the year, but I don't have an answer to what the rest of the state will be doing in terms of districts, in terms of stopping school for the rest of the year. So I thought these were some really great questions about how to provide socialization opportunities during COVID-19 and how can family success centers or parents provide these opportunities. So there's a few ways that we can do this. So one of the most important things is keeping routines and just learning to be creative. And some things that can be done is that despite that fact that we really are trying to limit the amount of screen time our children are having, but thinking about how can we do a virtual play date. So whether it's over FaceTime or WhatsApp, while they're on that, create a game, have them play charades, have them do a board game while on their virtual play date, or play Pictionary. A great way to interact with others outside of school, but a way for them to be playful and relaxed and creative. Or you can even do a virtual game night. So Pogo is one of the sites that allows kids to play some of their favorite games, whether it's Monopoly or Yahtzee. And again, and there's another one that you can play, Uno. So a lot of great games that are out there that you can play virtually. Pokemon Go is another way to get kids outside, which I'm a big supporter of, and track their activity and be active. Another great idea, which I've seen out in the community, so seeing it in Brooklyn and Philadelphia. And the FSCs is a great way for you to support your community, is doing these scavenger hunts. So it's basically playing I Spy out in the community. So they did this with the Quarantine Rainbow Connection. There is a Google map of participating homes throughout Brooklyn, which is I have a picture of there. And they have some type of message out to the community members to put rainbows in their windows. So children have been painting rainbows, sticking them outside on their windows so other people can see, and just create a scavenger hunt. It's a great way to get some fresh air, get some exercise, and connect with neighbors that you may not have connected with before, and to connect with other children while still maintaining that safe distance. What resources for teletherapy are available for children with mental health needs? So I just want to pause right here and talk a little bit about the stress and the coping about coronavirus. Everyone reacts really differently to stressful situations. So how we respond as adults, healthcare providers, parents, family success center staff is really important. And this is something to really make sure that we are conscious of, and realizing how fear and worry about our own health and the health of our loved ones can really affect our stress levels. And being able to recognize it in ourselves and others is very important. So realizing that stress could be a change in sleep or eating patterns, could manifest as difficulty sleeping or concentrating, worsening our chronic health problems, or even increased use of alcohol, tobacco, or other drugs. So it's really important that we do things to support ourselves and our loved ones. So one of the things I would suggest is taking breaks from watching, reading, or listening to news stories, especially social media, about the pandemic, because a lot of times it can be upsetting if you're watching this over and over again. So that being said, making sure you unwind and take a break from the news. Other thing, take care of your body. Really important to meditate, take deep breaths, stretch. Eating healthy is really important. A lot of times now we're just having more opportunity to stay inside, so we think that we don't need to exercise, but that's really incorrect in the sense that we need to exercise regularly. We need to make sure we're getting plenty of sleep. But also important is a social connection, connecting with others, talking to people over the phone, talking to people over FaceTime about your concerns and how you're feeling. So that being said, there are some teletherapy services that are available, and not just for children, it's for anyone. So I put them on the website on our slides, through the American Counseling Association, the American Psychological Association, SAMHSA with Substance Abuse and Mental Health Administration. So a lot of great sites, and 211, which I'll talk a little bit in a second. So how do I talk to my children? So I think this is really important because a lot of our children are going to respond to stress in different ways. So things that you want to watch out for in our children and teenagers, if there's excessive crying or irritation in younger kids, maybe even regressing in their behaviors they may have outgrown, for like example, toileting accidents or bedwetting, excessive worry or sadness, unhealthy eating, poor sleeping habits. In teenagers, you could see some acting out behaviors, or difficulty with attention and concentration, or like unexplained headaches or body pain. So it's really important to take time with your child or your teenager to talk about the outbreak, reassure that they are safe, let them know it's okay to feel upset. And you can even share a little bit about your own stress, and so they can learn how to cope from you. So it's important for you as a caregiver to be a role model. And again, limit your child's exposure to the news coverage, including social media, because they might misinterpret what they hear and can be really frightened about something they don't understand. Routines, really, really important to keep up routines, especially with schools being closed. Create a schedule, making sure they're waking up regularly at the same time, making sure that you have exercise as part of the activities, and making sure that they're eating well. So really important in terms of keeping up with routines. So I know there's a lot going on this slide, but I just wanted to put this resource out there from the World Health Organization about parenting in a positive way, especially during this stressful time, and ways that we can manage stress, keep positive, how to address quote unquote bad behavior, and how to talk about the stressful time with our children. So again, whether it's your clients or your families that are in the Family Success Center, it's a great way to talk to them about it. Some other sources for families. So given the higher volume of needs that we're having from our families, whether it be about food insecurity, housing insecurity, stress, one of the things that I just want to mention is there are services that are out there. And just as a reminder, we will be recording this webinar, and we will be sending it out to all the FSCs so they can review this and post this on their websites if they'd like as well. So COVID-19 resources. So Single Stop is a great resource. Anyone and everyone has access to it. It has great fact sheets about resources that are readily available, and even screening tools. So how can you access food or housing, medical care, and some local resources. NJ211, I mentioned earlier. It has some general information. And for those who want to speak to a healthcare professional, there's a 1-800 number. And then if you want regular updates about NJ COVID, you can text to that number listed below. SPAN, so many of you are familiar with the statewide parent advocacy networks. They have weekly family talk chats. It's a great way to talk about the stresses, about the physical distancing. And note, I say physical versus social distancing because it's important that we still remain to be social. It's the physical distancing that's important. How to talk about health and mental health issues, all those things. So those are available through Zoom from SPAN. Other things are being aware of families who face food insecurity. That SNAP and WIC have adapted their eligibility criteria, so they're a little bit more lax about who is eligible. For those who want more regular updates, the NewJersey.gov has a website to look for testing locations, resources. And there's also the Early Childhood Development Action Network. So this is a great way to find out things that you can do to talk to your children, but also fun activities, and also dealing with homeschooling or virtual schooling and how to manage that in this time. So at that point, I just wanted to thank you for your time and your participation, and open up the webinar for any questions that people may have.
Thanks so much, Drs. Traba, Verma, and Pai. So like Dr. Pai just said, we'll begin taking questions now from the Q&A box. So as a reminder, if you do have any questions to submit, you can either type them into the question box or the chat box, which is located either at the bottom or the top of your screen. We do have several questions that we've received throughout the presentation. I just want to mention real briefly, because we've received several questions about sharing these slides. We will be sharing a copy of the recording after this webinar. You'll receive it later this afternoon, and in that email, I will also include links to all of the resources that Dr. Pai just mentioned. So to get started, I have one question that I would love to share with Dr. Verma. I know that she has to hop off right about 1 o'clock. Dr. Verma, are you still on the line?
Yes, I am.
Wonderful. If we could just share this one question with you. We received a question here that asks, what does it mean if a test comes back inconclusive? Would somebody need to be retested if that happens?
So that's a great question. The current technology is really looking at a whole panel of the different viruses in the same family of corona. And that may be the reason sometimes it comes back as inconclusive. In those situations, if the patient has a true symptoms that are similar to the disease that we are questioning, COVID-19, then it would be considered positive. Does that answer your question?
Absolutely. So the next question that we have, Dr. Pai, I'll direct this one to you. What if somebody only has a few symptoms of COVID? So say that they have a cough and a headache, but they don't have a fever. Should they get tested?
So really, it's important just to be healthy, right? So we, like Dr. Traba mentioned earlier, we don't know if it's the flu, if it's allergies. So if you have a cough and fever is really one of the things that differentiates allergies versus COVID. So if you have a cough and a headache and no fever, it's not really, you still want to protect yourself and not really expose yourself to other people just to get tested, because if you are otherwise well and you don't need to go to the hospital, you're not going to do anything differently anyway. So just cough and headache, you just want to, make sure that your pain is well controlled with some Tylenol. If you're coughing, you can take some honey, drink lots of fluids. Those are the things that you would treat, whether or not it is COVID or the flu or even allergies for that matter. Great. And hand washing, always hand washing.
And Dr. Traba, can you maybe talk a little bit about the precautions that families should take if someone in their house is going to work every day as an essential employee?
Sure. That's a great question, as we are essential employees. So there's some differing opinion on that, but I think the general opinion is, if at all possible, that those essential personnel go into work with one set of clothes, change when they're there, work, and then change out of those clothes, and then they can still bring them home, but the idea would be to put them immediately in the wash so that you're not cross-contaminating when you get home. I think that's probably the simplest thing to do. If that person is otherwise asymptomatic, it's not recommended. They don't necessarily need to isolate from others. I think that's a personal choice depending on, how high risk the job someone is doing. But in general, you wouldn't isolate yourself until you became symptomatic. However, again, I think many, especially in the healthcare field, but even others, people are fulfilling really just as important jobs in terms of grocery stores and other, things that are still open that are essential to us to live every day. And so I think those are high traffic areas as well. So if at all possible, I think changing clothes when you get to work and then before you're coming home is a great idea.
Great, thank you. Dr. Pai, I'll go back to you for this next question. Somebody asked, someone I know no longer has symptoms, though they previously did. They've been in isolation for a week. Should they continue to be in isolation for another week?
So just to clarify, so they've been exposed?
So it doesn't say that if they've been exposed or if they've had a positive test. It just says that somebody previously had symptoms of COVID and they're no longer exhibiting those symptoms, but they've only been in isolation for a week.
Yeah, we're really recommending the 14 days because if you remember that that study that came out of Johns Hopkins, really the majority are going to have it for the first 11 days. So we want to be on the safer side. So really going with those 14 days.
Great, thank you. Dr. Traba, can you talk a little bit about some of the maybe information that's been circulated on social media? Specifically, this person is asking about gargling as a tactic to stop the virus.
Yes, definitely. To my knowledge, there's no evidence that gargling will affect the course of the virus. Will it hurt someone? Probably not, but it is not going to negate transmission of the virus or progression of symptoms per se.
Great, thank you. And Dr. Pai, can pets carry the virus? What about mosquitoes or ticks? Can they potentially spread COVID-19?
So I haven't heard anything about mosquitoes or ticks. In terms of pets, I think, we just want to stay cautious. So for those people who are positive from the virus, so if someone has COVID-19 and is symptomatic and in isolation, they also should stay away from their pets as well.
Great, thank you. Dr. Traba, what about any recommendations for women who are pregnant and will be delivering soon? Do you have anything that you can share about that?
Fantastic question and evolving day by day. I think most important, what I would say is have maybe a phone conversation, not necessarily in person, but have a conversation with your OB doctor, because I think each hospital has different guidelines or plans. But in general, I would say the same to everyone else, but even more so importance to be strict about it is really staying at home as much as possible, really just avoiding the exposure is the most important thing. I think individual hospitals are obviously taking as much precautions as possible to avoid any exposure during delivery. So they are limiting visitation in many hospitals. That's why I said ask your OB and the specific hospital so you know going in what their plans are. But in general, it's the same as the rest of us, but to be just as strict, if not stricter, about avoiding potential exposure. So again, social distancing to the best of your ability. And avoiding, public areas and so forth as much as possible.
Thanks.
And Brittany, if I can add to that, this is the most important information that Dr. Traba said, but another thing is that what we know from the previous coronaviruses, such as SARS-1 and MERS virus, they have not had shown effect on pregnant women. There are cases in studies from China as well as from Middle East where they have the mothers who were positive, but the babies were born even though the test was positive, but they did fine. The question regarding the long-term effect is still to be known because this is disease is still evolving. In terms of the current status in our country is that there are moms who are positive and the babies are being born. Just in our hospital, we had 3 babies who were positive and all 3 of them are doing fine without any symptoms.
Thanks so much, Dr. Verma. And you actually just answered another one of the questions that we had received asking about the long-term effects, which, like you said, are still unknown at this point in time. Dr. Verma, if I can also share this next question with you. Someone asked, and I know that we had kind of touched upon this earlier, but where can participants go if they don't have health insurance? How can they either get emergency help or get tested for COVID?
Any hospital. Any hospital. I actually asked this question specifically to our administrator in last call because we are getting updates on a weekly basis, and they told me that every patient is going to be entertained the same way, whether you have insurance or not. You're sick, you're going to be taken care of. No patient is going to be turned away, because it's in the best interest of the whole community right now that the patients who are sick get treated in an appropriate fashion.
Great, thank you. Dr. Pai, you talked earlier in the presentation about getting outside and going for walks. What if you have been in contact with someone who has tested positive? Is that still safe to do?
Well, it depends on what kind of contact you may have with that person. If it's a household member, then you really should be careful about exposing yourself to others, because you may have it too and just not have the symptoms at this point. So if you were in contact with someone who has the virus, and again, it's all about those 14 days. So you really need to really quarantine yourself for 14 days so you don't expose yourself to others as well.
Great. And Dr. Traba, somebody had asked, is it true that drinking hot liquids might help with this?
So I don't know of any evidence that it will help change the course, but I could say just symptomatically, I think it's always soothing if you have a cough or sore throat. But I think, just for more symptomatic care, I think it's fine and definitely will not hurt. In terms of just changing it out, like how quick you get better, I don't think that is true. However, just hot tea, those kinds of things are fine. But yeah, I see some people putting through, there's no need to do gargle or massively hot liquids. Just say you're normal if you drink tea or whatever you'd like as a warm substance. But yes, definitely nothing extreme.
Great, thank you. Dr. Verma, we also received a question from someone asking, actually we received a couple of questions related to this. Is it possible to contract this virus more than once? Or once you get it one time, does that mean that you're immune to getting it again?
So the immunity is a very good question, because right now we are not testing the patients for their immunity and how long that's going to last. So that's one thing. However, knowing the nature of the virus, because it's not changing its viral material inside, it seems like it's what we call a stable virus. And that means if one person gets an infection and develops antibodies, that would be long lasting. But that's based on an assumption that this virus remains the same, does not change its inside structure.
Great, thank you. And Dr. Pai, can you speak a little bit about the most effective way to keep a child's hands clean? I know that you've talked about, hand washing and using hand sanitizers. Any other suggestions or strategies?
So I think that is a difficult one, especially in our younger children. So when we talk about physical distancing, the kids are the ones that I feel like we really need to make sure are physically distanced for others, because, as much as we tell them not to put their hands on their mouth and their nose, on their eyes, they're still going to do it. So those are the, outside of just regularly hand washing, keeping them physically distanced from others as much as possible is really key in preventing the spread of this, or limiting the spread of the virus at this point.
Great, thank you. And one last question here, Dr. Verma, if you can maybe speak to this and explain why those with diabetes are considered to be in that higher risk category.
So diabetes is a disease that affects the multi-organ system in every person. Especially as you age, diabetes could affect the heart, diabetes could affect your immune system, and just the presence of sugar in the body for a higher level for a long period of time puts you at risk for infection. And that's one of the reasons why the patients with diabetes, or any other chronic illness for that matter, puts you at risk for more complication to any of the viral infections, including COVID-19.
Great, thanks so much, Dr. Verma. So I realize that we do still have some more questions in the chat box. It is 1:15 now, so in the interest of time, we're going to pause with questions here, but we will compile those questions that we weren't able to get to, and our pediatricians will share answers to those. We'll get those emailed out to everybody on the line as soon as possible. As a reminder, we will be sharing the recording of this presentation with all of you later today, and in that email with the link to the recording, I will also be including a copy of all of the resources that were shared today. So on behalf of the New Jersey Pediatric Residency Advocacy Collaborative and the New Jersey chapter of the American Academy of Pediatrics, I'd like to extend another warm thank you to our physicians for reviewing and responding to all of these great questions that we received. I'd like to thank all of our family success centers who gathered and submitted questions for this session, as well as all of the participants on the line for taking the time to attend today. You can expect, like I said, to receive that email with the link to the recording of the session later today. Thanks so much for joining us. We're wishing all of you a safe and healthy spring. And this concludes our webinar. Take care.
Thank you, Brittany.
Thank you, everybody.
Thank you.